Welcome everyone. My name is William. I'm a resident in orthopedic surgery at University of Toronto, as well as completing my PhD in biomedical engineering at SickKids. So I'm here to talk to you guys about focused ultrasound and its application as a potential therapy for tendon contractures. So let's start with the basics. What are tendon contractures? Contractures are defined as the abnormal shortening of muscles and tendons that renders a joint unable to be stretched. As you can see in the picture, the kid's hand is actually fixed and frozen in that position. So it's always at that angle and he's unable to use it to do any activity such as eating or writing. And this happens in kids, as I said, who suffer from neuromuscular dysfunction such as cerebral palsy. However, it also occurs in adults that suffer from stroke, spinal cord injuries, or even skin burns. The treatment for contractures include physical therapy, bracing, and orthotics. However, the definite treatment is surgery. In surgery, we will find a tendon that is actually contracted and just cut it open. Once it's open, it opens up the joint and allows the patient to use that given joint. However, there are some downsides to surgery. They include the risk of bleeding, the risk of infection, and the need for pain control. So we started looking at more non-invasive treatment modalities. So one of our modalities included focused ultrasound. And in ablation mode only, we have been successful in giving more range of motions after cutting the tendon non-invasively. As you can see, this is a picture of the Achilles joint or Achilles tendon in the ankle joint of a pig before the treatment ablation. And then following that, there is a great increase in the range of motion. Unfortunately, one of the side effects is actually skin burn, which is undesirable in the clinical setting. Another treatment modality we looked into was histotripsy. With histotripsy, we tried to maximize the negative acoustic pressure possible in our system, which was 20 megapascal, and we're not able to disrupt the tendon. So one of our hypotheses is combining both histotripsy and ablation with the aim of being able to disrupt that tendon while reducing the energy that was delivered. For this experiment, we collected ex vivo fresh porcine tendons, we degassed them and embedded them in 2% agar. After that, we obtained pre-sonication or pre-treatment imaging, treated them with focused ultrasound, we obtained post-sonication imaging and performed statistical analysis and measurements. For the treatments itself, we use a Sonalleve V1 system. And for histotripsy, we chose 3 different negative peak pressures of 8.3, 10.6, and 13.4. Those were the pressures that the system allowed us to use. Following either of these treatments, we will set up some ablation therapy. The ablation therapy would be of 20 watts, 30 watts, and 40 watts. This created a total of 9 combinations in the 3x3 matrix. In this picture, you can see the treatment ongoing following both histotripsy and ablation, and there's minimal temperature spread, as you can see in the temperature map. Additionally, following the treatment, we could visualize the area of hyperintensity that is circled there, corresponding to the treated tendon. And for each treatment, we'll measure the volume by measuring both the sagittal and transverse length of the treated area. What we found out is that for a given treated power, for example, 20 watts, as negative pressure was increased, the area that was affected was increasing similarly. Then looking into a given histotripsy negative pressure, as the power was increased, we also noticed that there was an increase of area that was treated, which is the area of hyperintensity. Following this, we did some logistic regression studies and found out that when we looked into the interaction of both histotripsy and ablation, there was a high coefficient of correlation with a p-value less than 0.05, which was statistically significant. Given this result, we are able to conclude that there is a potential of combining both boiling histotripsy and ablation with the goal of controlling and producing a more narrow treatment effect as less power and less ablation power and less boiling histotrypsy would give us a more narrow treated volume. Additionally, this would translate into a lower energy that is deposited, leading to less skin burns and thermal damage. This will open the door for our future in vivo studies of using both combined boiling histotrypsy and ablation for the treatment of contractures. With this, I want to thank all my co-authors, as well as all the departments that have supported my research, as well as all the attendees here. Thank you very much for your attention and enjoy the rest of the conference.